Hello friends, happy Thursday. Hope y'all are doing good. We're waiting on Miranda. She was actually doing a live on another thing, but we're gonna wait on her. Let's see if I'll add her in just a second. So I'm Hallie. I'm a physician assistant in dermatology, and we want to talk about rosacea. So lots of people are affected by rosacea, and so I'm going to bring Miranda on with me in a minute. She has been battling with rosacea, and we'll tell you about that. But for those of you who don't know me, if you follow me, you know I do dermatology. I love rosacea. I have lots of patients with rosacea, but a lot of people don't know they have rosacea. So we want to educate them on that. All right, let me see if I can bring Miranda on here. Hang on, guys. Let's see if she can come on. Let's see. So anyway, while we're waiting on her to jump on, if you have any questions, oh, there she is. Hey, y'all type them in the comments. Let us know you're here. Tell us where you're from. And we would love to answer like all your stuff at the end. So we're just going to kind of go through a little bit. This is Miranda Benson.
Hello.
So Miranda is a dear friend of mine. She is a mom of 3 littles. She is a wife, a speech pathologist, a stain artist. She is an amazing mentor, an amazing friend. My hype girl, literally, like if you have even been like kind of sort of liking my content, you can thank her because she's really the reason that I like started it. So she's amazing. I love her. And she has battled rosacea. So whenever I think if I'm not mistaken, Randy, you correct me, but she had like 3 kids under 3 at one point, right? And so during that time, we kind of battled with her face a lot. And so she's kind of like my magazine girl because we kind of like work through it. And I want you to know that if you have skin conditions, it can take a while. So it's not magic. Like you go to the dermatologist, and I see a lot of people like, I went to the doctor and it didn't get any better. But sometimes it's an art, guys. Like everybody's not the same. Products don't work the same for everybody. You know, everybody's just not the same. So sometimes it takes us a little while, but if you really trust your dermatologist or like whoever's taking care of you, just work with them, tell them the problems, tell them what you think, and then you can kind of work forward. So we kind of did that with Miranda, but we wanted to hop on because April is Rosacea Awareness Month. Y'all, there are like 16 million Americans living with rosacea. It's super common, and a lot of times people don't even know they have it. So I see lots of patients all the time that's like, I have redness on my face. Nobody's ever told me I had rosacea. Do I have rosacea? Some people say I have lupus. Some people say I have eczema. Like, I don't know, but I've dealt with it forever. I'm tired of dealing with it. Nothing's ever helped. All the things. And so we want to help that. We want to make you aware that there are things that can help that. And that to know that you're not alone. Like a lot of people struggle with this, and there are ways to help it. And honestly, like, even there's not really a cure, but just make you feel better about it and increase your self-esteem, that kind of thing. So that's why we wanted to bring Miranda on. She's a stain artist with me, so I am a stain artist. She's wonderful at masking acne and rosacea if you're struggling with it. So I want you to go follow her. She has all the acne makeup tips, rosacea makeup tips, covering it, all the things. And then I like to do the skincare part, and I've never struggled with rosacea. So honestly, I don't have a lot of experience like covering it up, but she does. So at Miranda Kate, go follow her. I'll post that later. So let's talk about what is rosacea really quick. So it's an inflammatory skin condition. It causes redness, flushing, dilated blood vessels. It can cause acne, so you can get acne rosacea. It can actually cause like thickening of the skin of your nose called rhinophyma. It can cause eye irritation, so you can get rosacea in your eyes, and some people have that and don't even know it. So rosacea can be really bad, and most commonly it's here, and so a lot of people are like, oh no, I have a butterfly rash, I have lupus. So don't freak out. Some people do have lupus. That's a little common, but not as common as rosacea. So a lot of times people are like, I Googled it, I think I have lupus. I'm like, oh, no. Let's back up. But anyway, it can cause lots of problems, right? And so what can cause it? The truth is we don't really know. And so it can be a lot of things. It can be genetic. It can be certain triggers. It can be like autoimmune kind of stuff. some holistic medicine doctors, and I don't disagree with them, think some of it is gut health. The things we eat that are inflammatory can cause it, definitely can cause flares and triggers. Hormones, I think a lot of Miranda's was hormones that was causing hers to flare. And so just so many different things. Like some of the triggers can be stress. Y'all, stress causes havoc on your skin. And so, when you have 3 kids under 3, that's stressful, and are your hormones and all that. And so that could be one of the causes. Some, exercise, anything that dilates your blood vessels and makes your face redder. So exercise, sunshine, alcohol, stress, obviously, and spicy foods. Like that kind of stuff can make you have a flare. So a lot of times you have to just kind of figure out what your triggers are. But sometimes no matter what you do, it just doesn't go away. And that's kind of where we were with Miranda at one point. It happens more common in women than men, although I do see lots of men with rosacea too. It happens more commonly like 30 to 50-year age range. And fair skin, blonde hair, and blue eyes, which is Miranda. So that's kind of common. The crazy thing is a lot of rosacea stems from like Northern European descent. And we think it's even caused by like Demodex mites. And so that sounds gross and kind of crazy, but people that have ocular rosacea, you can actually look on a microscope and see like the little mites in their eyelashes. And so, and on their skin, if you have a microscope, which is kind of cool and kind of not, right? So anyway, Miranda is getting hurt light or something. But those are kind of the most common triggers for rosacea. That is what rosacea is. I'm going to turn it over to Miranda and kind of let her tell you her battle with rosacea and how we kind of like got it under control. And then I'm going to look at the comments too, because I think we have a couple, and just see what we got going on. And if you're just hopping on, let us know where you're from, that you're joining us, whatever you want to ask us, because we're going to answer it later. All right, Miranda.
Hello, good morning. So thank you to Hallie for inviting me on and kind of partnering with me on this. As she said, I'm Miranda. She gave a great little bio intro for me, and Hallie has been my personal dermatologist. How long have you been in practice? I
Almost
was like
9
8 or 10
years.
years.
Yeah.
But really for us, it's been, like she said, the last 3 years is when my rosacea really heightened. With my last pregnancy, rosacea really heightened for me. And before that, I was one of those people, like she mentioned, that just kind of thought, oh, I have a little redness in my skin. Or, oh, like one of my grandfathers is like part Cherokee, and it's kind of like that, more redness. And I get red at times. But then also, I have a mom with lupus. And so when I was in my last pregnancy and it got really bad, and it was definitely this area, like she said, that's similar to that butterfly rash. Okay. And then I kind of had it up here, but I also had the hormonal acne kind of that like can kind of come along with it. Like she mentioned, we were like, oh man, is this hormonal acne? Is this rosacea? And got to the root of it, or I say the root of it, we figured out it was rosacea. And I really looked back on different times in my life where I was more red toned and my skin was more inflamed. And it was definitely, times of stress or hormonal indicators. During my first pregnancy, I battled really probably rosacea for the first time, but the acne that went along with it. And then I was one, like she said, I had 3 kids that were within 3.5 years, but I also was breastfeeding or pregnant altogether for like 6 years. So the hormones of the pregnancy and breastfeeding just on my skin.
Total rock
Oh my
star.
goodness. All the hormones, all the stress, like anything that could be a trigger sign really was like triggering my skin. And so there were things we could, like Hallie, like she worked with me on treating it, but also there was things that triggered it that I could only do so much for those things. Like I wasn't about to get rid of a kid. So the like stress and the 3 kids, like I couldn't really help that.
And a lot of medicines we like to use for rosacea, she couldn't do because she was like pregnant or nursing, right? So you can't do a lot of things that you would normally do. So we were like,
What do we do? And so many people, the hard thing, and like Hallie said, luckily for me, I will say during that time, I truly, when mine was probably at its heightened, at the worst, the Lord really protected me, and that I didn't realize how bad it was. I look back now and I'm like, oh man, my skin looks so angry, so irritated, like it was very much hurting. And I didn't realize how bad it was, and how bad it looked, because it was not painful, but it was definitely heightened. But now that's something that, you know, I definitely like worked through, and we kind of figured out some things that worked for me that I could do even still while pregnant and nursing, and kind of tried to do those. And then as the years have gone on, have changed a few things, but I've been able to use that to reach other women, help other women, because that's a big thing that, you know, Hallie mentioned, is so many women, number one, don't, or men don't realize they have it. We just think we're red, or, you know, that's just my skin. That's just my skin. Um, but they don't realize, like, number one, we can't necessarily get rid of it, but we can diminish the appearance of it, or we can help the triggers, like don't eat the spicy food, or eliminate some of the stressors in your life. And definitely, I feel like gut health too. Hallie mentioned gut health. And for me, making sure I've really, over the last like 14 months, before I weaned, really got my diet kind of more in check. And I used, honestly, pregnancy and breastfeeding as like a crutch to kind of eat whatever. And so then when I really tried starting getting that, it really, that gut health of that and watching what I eat and eating cleaner and different things has, I feel like, helped it as well.
Yeah. So our lifestyle factors, guys, affect our skin a lot. So people that have eczema, rosacea, psoriasis, it's the craziest thing. So, you know, people that work night shift that don't have a regular schedule, their skin's worse. So if they have rosacea, if they have psoriasis, if they have whatever, and they're working nights, I mean, anything that disrupts normality for you. So whether that be like stress, what we eat, lifestyle factors make a huge difference. So if you have some sort of inflammatory condition, even if it's not rosacea, if it is psoriasis or eczema or whatever, like we have to get the lifestyle factors under control, like she's saying. So you have to like somehow try to decrease your stress, even though that's hard. You have to eat right, because the foods we eat fuel our body for success, right? And so if you're eating like crap, I mean, honestly, you're going to feel like crap and your skin's going to look like crap. That may sound a little harsh, but I truly believe that. And then obviously, like things we can control, you know, skincare, makeup, all those things make a huge difference in our skin and our life, honestly. And so, Myrna, do you have anything else before we talk about kind of the
Um,
treatments?
I don't know if I mentioned this too, but I will say, you mentioned like autoimmune and lupus and things like that. So I think it's, I was going to ask you, because I know, I don't remember if I said this earlier, but my mom does have lupus. So that was one thing when mine got really bad. I was like, Hallie, do I have lupus? Like, has my pregnancy triggered it to come out? So I would ask you, for the person that is maybe like, okay, is this autoimmune or is it rosacea? What's your key indicator kind of between those that kind of helps you know, like, all right, let's calm down, or hey, let's pursue this?
Well, honestly, like lupus can be, I mean, oh, no, can't be. Lupus is autoimmune. Rosacea can be autoimmune, and it can be genetic. So, like, lupus can be genetic, rosacea can be genetic. But what you have to realize is a lot of times lupus is kind of like a more severe illness. Okay. So it's like more of a systemic thing. A lot of times you can just get skin lupus, but a lot of times if you've got the butterfly rash and you've got all these, then you've got fevers and you've got joint pain and you've got, I mean, you feel bad, you've got fatigue, you've got all the things. Okay. So if you have, there are certain criteria you have to meet in certain boxes that doctors look at, or, you know, we look at to see, check this, check this, check this, check this. Do you have all those? You may have lupus. Let's do the lab work. But if you clearly just have red skin, and honestly, if you have the acne with it like you do, that kind of triggers us to like, this is probably more rosacea and more inflammatory rather than lupus. Now, that is not always the case. And can you have lupus and rosacea? And you can have all the things. That's where this gets complicated. And so, you know, in the medicine world, it can get really complicated as far as like people that have all the things, right? But like with you, it's like, okay, your mama has lupus. Let's keep that in the back of our mind. But let's also think, do you have any other problems, symptoms? I mean,
Yeah.
we're all tired. Okay. But I'm talking about like severe fatigue. You know how your mama is. Okay. Do we have fevers? Do we have, you know, is there anything else we need to be looking at? If not, then let's focus on the rosacea part. Let's see if we can get it better. Let's see what we can do, you know, and sometimes if all else feels like, okay, well, maybe something else is going on. Let's figure that out. But I mean, that's kind of how we look at it, if that makes sense. Okay, so like she said, we talked about lifestyle factors for sure can help our skin, right? But a lot of times, once again, no matter what we do, doesn't help, doesn't go away, whatever. So we have to resort to other stuff. So there are lots of stuff to treat rosacea. There's medicines like doxycycline, minocycline, which actually they're antibiotics, but they have a bigger anti-inflammatory property in them than actually antibiotic property, or about the same. So they decrease the inflammation of the lesions in the skin. So a lot of people are like, "Why are you putting me on an antibiotic for rosacea? Like this isn't bacterial." It's not, but the medicines that we choose are more anti-inflammatory. So they help in decreasing the dilated blood vessels, decreasing the redness, decreasing the acne and the inflammatory lesions if you have those, okay? If your rosacea is caused by Demodex mites, you can actually do topical ivermectin. I know that's crazy. Ivermectin is used in COVID, but it can really make a huge difference. So, and there's also other medicines that last for a certain amount of time, so like 12 hours a day. Like say you have an event you need to go to and you don't need to have any redness, okay? So there's stuff like Rosacea and Morvaso, and all they do is sit on top of the skin, but they like vasoconstrict the vessels, okay? So the dilated blood vessels that cause the redness and the flushing, they bring those down so it doesn't get so red. Cool fact is those are really expensive. But Rofade is actually a branded oxymetazoline, which is the same thing as Afrin that you put in your nose. So if you have some crazy, like, not crazy, if you have some function like you want to go to, like a dinner or whatever, and you just don't want to be red, you can literally put Afrin or Afrin, I don't know how you say it, whichever way you want to, I guess, tomato, and it'll vasoconstrict those vessels and decrease the redness. Super cool. Okay. So there's medicines, there's topical treatments. We actually compounded something for Miranda while she was pregnant. It had azelaic acid in it. Azelaic acid is over the counter. There is a prescription form, but it is wonderful for rosacea, especially acne rosacea. So if you think you have this, but it's not a severe case, like you don't want to go to the dermatologist, I would recommend adding azelaic acid to your regimen. We actually compounded something for her. There was azelaic acid, cilantro, which is topical ivermectin, and then Metrogel. So Patty asked, what do we think about Metrogel? Metrogel works wonderful for rosacea for some people. That's usually what I start with. Insurances like it. They'll pay for it. They don't love azelaic acid and they don't love cilantro. It's very expensive. And so a lot of times I'll use a compound in pharmacy for those. But Metrogel is pretty affordable. It works well, especially in combination with doxycycline or an antibiotic. And so yes, I think it's good. And some people just say, you know what, it doesn't work for me. Some people say, you know what, I've been using that gel and it works wonderful. Okay. So if you've tried Metrogel or if you haven't, I think it's great. If you tried it doesn't work, then just talk to once again, it's all about communication, you guys, okay? So, if none of that's helping, you can do lasers, that kind of thing at like a lot of rosacea. They have rosacea treatment centers are like just regular, but some lasers will help rosacea too. So those are kind of the treatments that we go from like topical medicines to oral medicines to, to lasers, that kind of thing. But the main thing when we're talking about rosacea, especially if you just have mild rosacea, or even if you have severe, and what we work with Miranda is like skincare and makeup. And y'all know, if y'all watch my stuff, I'm all about simple. Like, I'm a busy mom. Miranda's a busy mom. We don't have time for like a 30-minute regimen of skincare, a 30-minute regimen of makeup. Like, no, we're not doing that. And so the biggest thing is like controlling your lifestyle factors, like we talked about, and then the simplicity of makeup and skincare and makeup. So realizing that if you put 10 things on your skin, it's gonna maybe go crazy, especially if you have sensitive skin. And I'm not saying you can't have a 10-step skincare routine. You just have to be careful. If you're using like a ton of retinols, or what we call actives, so like retinols, benzoyl peroxide, salicylic acids, like all the things, you're literally wreaking havoc on your skin. And so it's just not gonna work. And so, as a dermatology PA, I want everybody to have a good skincare routine, whether it's 3 steps or 10 steps, but I like to just go simple. And Miranda does too. We simplified her skincare routine. And then obviously I said, like, she's a makeup artist, so she got the makeup part down. We use Saint Makeup. It's a cream makeup, and I'll let her tell you a little bit more about that. But it's very good for your skin, very moisturizing, very clean. And so literally simple is better. So a gentle cleanser in the morning. Miranda couldn't even use vitamin C for a while, and that's fine. Like azelaic acid, if you have rosacea, is really good. A moisturizer and sunscreen. You guys, rosacea is irritated by the sun. You want to block those rays, UVA, UVB. You must wear sunscreen if you have rosacea. Okay, that is a huge factor. And then at night, just a gentle cleanser. If your rosacea is acting crazy, you aren't using retinol. Okay. I know I say everybody should use vitamin C and retinol. I do believe that if you have skin that looks like this, okay, if you want skin that like to anti-age and all that kind of stuff, but if you have a broken down skin barrier, that's not for you. Okay. So everybody's not the same. Everybody's, so simple's better. And if you want, just message me. I can send you some rosacea recommendations for skincare. Now, Miranda's going to talk about how to kind of, it took us a while. I'll be honest. It's an art. It took us a little while to like work through her skin stuff. So she wants to talk about if you have rosacea and you can't get it under control, like it's not the end of the world. There are ways that we can like work through it and cover it up with makeup and just know like she's gonna talk more that you're not alone. All right, Miranda, your turn.
Okay, back to me. So, like Hallie said, I do think when it comes to skincare, like she said, one size fits all is not the thing. So, Hallie and I both are about simple. And we literally, for a period of time, went for me back to like a face wash, moisturizer, and sunscreen. And that was like a solid probably 18 months. And it really helped my skin. It kept the inflammation down, and I would be like, "Hey, Hallie," because she would, she talks about retinol and she talks about these other products. I'm like, do I need it? Can I do it?" And she's like, "Nope, nope, we don't want to introduce anything else." And so I will say, whether it's skincare or makeup, anything you're putting on your face, if you have sensitive skin or rosacea, don't start 3 new products at once. Okay, so don't.
Even if you don't, if you have great skin, don't.
Probably not. Um, so for me, I know that if I'm starting some kind of new skincare, I'm going to try one product at a time and see how my face reacts to it, and honestly give myself a few weeks. And that's with a new product or a medicine. So even when Hallie like recommended or prescribed something for me, if it didn't, I want an immediate reaction because that's today's society. We want a quick fix. We want it to start working. And especially when my rosacea was so bad, I wanted it gone. I wanted some clarity. I wanted more skin that was like this. And, 2 weeks wasn't quick enough, right? Or whatever it was. And Hallie was like, you've got to give it, some time, be consistent. So I think there's so many things in life we talk about being consistent with. So I had to be consistent with my skincare. And that's hard as a mama. Any of you other mamas, you know that like you get everybody to bed and you just want to go sit on the couch and you don't want to do your skincare. So I think that, but then also giving it time. So for me, that skincare, makeup. And then with makeup, the one thing is, like Hallie said, I also asked her because we're both, like she said, Saint artists. We both use a cream-based makeup system. So I'm like, okay, is it the makeup that's irritating it? I've been wearing the makeup for over a year, but could it be this? Like, I don't think it is. Nothing I've read would be anything that would irritate my rosacea. And she reassured me it's not. Like creams are hydrating for the skin. There's nothing in them that typically any of our products or ingredients. We have minimal ingredients in our makeup. So that's not typically something that's going to irritate it or inflame it anymore. And like I said, it's hydrating. So it's not putting layer upon layer on the skin. It's keeping it very simple. And since our makeup system, I don't know if y'all are familiar with it, but it's like your whole face, like right here. And there's the same ingredients. So I'm not putting all these different ingredients all over my face in multiple layers. That really helped. I just put one layer of all of this. And what I love, and Hallie and I, like, we really talk. She has like several clients that have found me, and they're her either dermatology clients or makeup clients. And like Hallie said, she doesn't struggle with rosacea. But I love with our makeup, the way our founder created it is there's certain colors that have more of a green base, and so green cancels out red. So you can use minimal amount of product, but the tones in it help to combat like the redness. So you wouldn't know it now, but like I have a color like right in here to where I'm a little more red today. And like here, I always keep redness. And so I have like a shade that I use has a little bit more of green undertones. So it helps to combat that. So I'm not having to use like a concealer or a really thick foundation to get coverage. I can still use minimal amount of product on my skin and get the coverage I want and need. And I think that's huge. Another thing that's like not necessarily the coverage aspect, but a thing that I always help like any of my gals that struggle with rosacea or anything like that. I know for me personally, I have melasma here and it does not bother me a bit. Like I've never hardly ask Callie anything about it because that does not bother me. My bronzer's usually there or contour and it's not noticeable. It was also pregnancy induced. I'm telling y'all, pregnancy and those hormones they just do
Babies, they cause
all kinds of
problems.
stuff on you. Like she said, they can wreak havoc on your body. But for me, one thing is like blush colors. So this is a thing with makeup a lot of people don't think about, or maybe it doesn't bother some people, but I have noticed for myself, and this is one thing I like try to teach within like a private group that I have, is I am more self-conscious about my redness, and especially because mine is here, kind of like that butterfly Hallie mentioned, right? So I don't like, there are certain times where if it's more prominent or if it's bothering me a little bit more or something, I don't want to embrace the pinkness here. And so I like to use more like orange tone colors that we have, that also that orange tone kind of not neutralizes but softens the redness, and it's more of like a natural glow. Or sometimes you can allow, depending on your redness, you can allow that natural flush that you have. Like, number one, we have a natural flush in our cheeks, but then also you have that from the rosacea kind of peek through. And so you're not having to put a blush on, you have the natural like soft and pinkness of rosacea. And so you're really eliminating the product that you're putting on. And that has really helped me trying to figure out, what is it about my rosacea that does bother me? And then how can I use makeup to diminish that? So Hadley and I both, as simple as we are about skincare and makeup, we're also about enhancing the areas you love and diminishing the areas you don't. So makeup is not meant to like mask who you are and to like cover up and be all this. Like, we don't want that. You were created in his image. You are beautiful. You don't need or have to have makeup, but it's a beautiful thing to be able to use and to diminish the appearance of some things that like life has thrown our way, right? And just the wear and tear, like she said, lifestyle, but like environmental, just like I just think about the day to day of our skin and the junk we come into contact with that gets on our skin, right? And how it does our skin. So just embracing more of that for me. So like embracing the natural pinkness if I want to, and not using a color that's really going to enhance it if I'm wanting a more natural look.
For sure. And look how beautiful she is. I'm telling y'all, she's the best hot girl. So, like, if I'm ever like, she's like, no, girl,
You
you
do
got
it and
this.
you don't go do it now.
Okay, so with that being said, we really just want y'all to be aware. First of all, rosacea is super common. So I don't want you to ever think like I'm the only person with this. That's not, no. 16 million Americans, okay? Lots. Miranda's one of them. The other thing we want you to realize is there are ways to help it. And so a lot of people, they've gone to the doctor and they're just been like, oh, you have rosacea. Okay. And they don't offer any advice. They don't offer any help. They don't offer any kind of anything like, oh, it's just rosacea. So, and a lot of my patients have come to me and is like, I've been told I have rosacea, but nobody's offered anything to help. So, there are things that can help. You just gotta find the right person to like work with you, talk through it, that kind of thing. But just know, like Miranda said, it is a consistency thing. It is a figure it out kind of thing. And it is a figured out what triggers yours, what helps yours, what hurts yours, like what foods can we eat, what foods can we eat, whatever. And then to know that there's also like if you're going through this and we're trying to figure it out, there's ways to cover it up. And so not that we want to cover it up, but like there's ways to embrace it or enhance it or, like minimize the redness, I guess. And so if you struggle with that, Miranda's your girl. Like I said, I've never struggled with rosacea. And so I can't really be like, use this color. I mean, I can just knowing what she's taught me and like what our company's taught me, the greens cover the reds, whatever. But the tips and the tricks and the how to cover the acne and the rosacea and the redness and all the things, like for sure. And if you want to know skincare stuff, for sure. I mean, we are willing. This is what we do. Like we love helping you guys, and so we don't just hop on here because we have to. We want to help you guys have the best skin and makeup of your life. Like literally, as a busy mom, to feel good about yourself. Because we feel good about ourselves, we're going to be a better mom and a better person and a better physician assistant and a better speech pathologist or
And you
whatever we're going to be.
mentioned
Okay, so that's what we
you
want
mentioned
for y'all.
this earlier. You said something about like not feeling good, and like when you're stressed and you don't feel good, and then like your face or things like that. And I just think about if you're feeling better. So like we talked about lifestyle things like eating better or stress and like all those environmental lifestyle type things. So if you are like, you're going to be not as happy about your skin. Whereas like I was at a state where you had really helped me when my face was like, I'm going to say so bad. Okay. To where you would help me with a lot of those things I could control. So I felt really good. So I think I didn't realize how bad my face was because I felt really good. And so
Yeah.
it wasn't that thing where it's like, if you're not feeling good about it or you're not taking care of yourself, you're not um, in tune with what's going on, you're going to be, I think, more aware and more bothered by
Yeah.
what's going on.
Or if you think nobody's going to help you or there's
And
not a help, you're right. And so
that's a
it's huge.
huge thing. So many, and I think too, so I keep thinking of things, but so many of the people I come into contact with have never been told that they actually have rosacea, right? They're adults like me, 30, 35, and a lot, like Hallie said, a lot of us don't really get it or heighten until we're adults, until 30-ish. And that was like my case with pregnancy. Um, but I never really knew I had it. I just thought, oh, my skin was a little bit more red. My mom has red skin, but she has lupus, and I never really like tied that. I just thought like Cherokee, and so I know when I get a lot of makeup free selfies for women to help them with makeup, I like, I don't want to say like, do you have rosacea? And so if I will say a lot of times I'm hesitant to mention their redness, right? But I like want to know, like, does it bother them or not? Like, do we want to minimize that with makeup? So I think I want people to know that like there are ways to minimize the appearance, just like Hallie said, with makeup. But then there are also like very simple things you can do with skincare. But it's also like I think a trial and error thing. Like Hallie said, like we can do basics of skincare, but as far as when it comes, and I think this was a big thing that even now, like 3 years into really like I mean, we've been really dealing with rosacea for 3 years consistently. Like it goes up and down, and there are things that irritate it. But me not realizing, like one of the things that I use is more of a preventative instead of like when my rosacea is heightened. Like the other, I feel like a few months ago I messaged you about a product, and you were like, "I want you to use that every day. That's a preventative. Like that's part of your skincare routine. That's not like a medication." And so,
Some people think, like with their blood pressure medicine, it's like, oh, well, my blood pressure is good, so I should probably quit my medicine. No, that your medicine's what is keeping your blood pressure good, right? So Miranda's one of those girls. But no, if you have something that like prevents it or makes it not so red, we have to keep using it. And unfortunately, our skin is like the biggest organ of our body, and we honestly have to treat it like that, like our heart, like our lungs, like our kidneys, whatever. And sometimes we have to do stuff for it on and on and on and on to keep it healthy. And you know what? It's okay. It is good. We can do that. We can just, if that's what it takes. But we really want you to know that there's help. And so reach out to us at Miranda Kate for all the makeup tips. Or if you're struggling with rosacea and just need somebody to like tell about it and be like, what did you do that helped? Whatever. I can help with that too, but she has a personal history, skincare. So now we're going to do some question and answer type things if Miranda doesn't have anything else. So Catherine says, my son had a lot of redness on his face. Is there something as far as skincare? So if you just have redness, like we said, simple is better. Gentle cleanser. So CeraVe, Cetaphil, they make super good cleansers. Actually, Aveeno makes one that's called Aveeno Calm and Restore, and it's for redness and inflammation soothing. They have a wash and a moisturizer. Super good. La Roche-Posay is a French over-the-counter brand that I love too, and they make something called Rosacea, and I've actually just kind of gotten to have a little bit of experience with that. I don't even think I've told Miranda about that. But it is a moisturizer type anti-inflammatory kind of thing you put on that soothes the redness and the inflammation. It is really good. The biggest components of your skincare are going to be gentle cleanser, moisturizer, sunscreen, because you want to keep your skin barrier moisturized and hydrated and protected, so to calm down the inflammation. Another thing is in Saint we have the Saint cream or the Saint milk cream. Milk, crazy enough, calms inflammation. Okay. And so all my people with rosacea, Miranda, when we first started this, she's like, should I stop my makeup? Should I stop my Saint cream? No. the milk in the St. Cream actually helps rosacea, helps the redness, helps the inflammation, all that. So we actually kept that for her. We kept the makeup, we kept the St. Cream, added some other stuff and did good. So those are the main things. But Aveeno does have a common restore that's really good. And then La Roche-Posay has the Rosaliac that are actually for rosacea.
And I
All right. What other
I was going
questions?
to
Oh, go
say
ahead.
this too. Like, if some of you do struggle with rosacea and you think like there's no help for me, kind of thing, or even if you just want to see, like, I would love to share with you because a lot of people are blown away that didn't know me 3 years ago what my face looked like 3 years ago. And I've had no like medical grade treatments, like laser, like any kind of things like that. Like, it's truly been like either skincare or like an ointment. But a lot of people don't realize how kind of bad and inflamed my face was.
Okay,
And then I also, and
you
I'm happy.
can you put some pictures of that on
I was about to
stories
say,
for them to look at, like
we'll
before and
share
after?
this live to our stories, and then I'll share some like before and afters, or like some
Mm-hmm.
photos from then to now, kind of my journey. And then I'll also share the milk cream, like Hallie said, when I use it consistently, because it's a thicker cream, so I use it at night. But when I'm good about using it, because I'll change up sometimes my moisturizer depending on the time of year. But if I ever start getting like a little bit of inflammation, I'll start back using it. And within like 3 or 4 days, it really does help diminish that. But sometimes it's so thick, I don't want to use it every night. So I'll change up to like a lighter one. So.
Yeah, it is kind of thick for the day, but at night you kind of want a thicker one. If you're using retinol for sure, obviously if you have a broken skin barrier and active rosacea, you may not want to, but the St. Cream is really good, like after retinol if you're using that. Okay, so I developed rosacea after I did my precancerous AK treatment. I think my dermatologist ruined my face. I haven't even put that cream on for 4 weeks. My face actually bled. Okay, so yes, he. I don't know who your dermatologist is, but we use that cream because it is a chemo cream. It does get rid of sun damage, precancerous cells, and actually cancerous cells. So if you have a lot of sun damage that you can't like treat with liquid nitrogen, we will recommend that cream. And that's what it does. It is like a chemical peel. Okay. So this is normal. This is a normal reaction. And I know it's not normal for you, but for dermatologists, that's normal for you to literally get so red and irritated and bleed and that kind of thing. For that kind of stuff, that's normal if you had a ton of sun damage. And honestly, the cream doesn't react if you don't have sun damage. And so, like, if you put it on your booty, it probably wouldn't do anything. So, I understand what you're talking about. And a lot of my patients are like, I think I'm allergic to this, or I'm never using that cream again, or whatever. But I bet they thought it was in your best interest to not get skin cancer to have that. And so that will ruin your skin barrier. I agree with you. But after you get all that sun damage peeled off and get the redness gone, you will get new skin and it will look red or pink, okay? Like a baby skin. And so I want you not to give up. Once again, talk to your dermatologist about it. Work through it. Let me know, because this is a process that you really do have to baby that skin. Sunscreen, 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 moisturizer. La Roche-Posay makes something called Cicaplast Balm that is wonderful at healing skin barriers. You don't need to put anything on there, on that new skin that's going to irritate it. So he may not have induced rosacea. You may just have very sensitive skin now because it's brand new, almost like a newborn. Okay. And so, yeah, very minimal skincare, like she said, Cicaplast Balm, moisturizer, and no actives, no retinol, no vitamin C, no acids, no nothing until that skin kind of heals up, and sunscreen every day. Once that skin, so most of my patients, they're mad at me when they come back in 4 or 6 weeks and their skin looks like that. They're like, what have you done? I'm like, listen, I need you to give this like 6 weeks and you're literally gonna come hug me. And they're like, I don't think so. I'm like, you are. So in 6 weeks they come back and they're like, feel my skin, look how good this skin looks. It's literally no skin. And so if you are at very high risk of getting skin cancer, we don't want you to get that. So they're actually preventing that. Okay. So he peeled your skin off to get or he or she, whoever it is, I say he, that's crazy, to get rid of that sun damage. But you can get it back. You can get that skin back and it'll probably look better than it had. So if you have any more questions on that, you can always reach out to me. But I want to say, like, that's one of those things where you have to get through it. You have to work through it. It's a process. It's a consistent kind of thing. And don't give up.
I
Okay.
feel like there's so Many
Let's see.
things with I just from being close to you learned there's so many things with skin that it's like it gets worse before it gets better. It has to purge before it gets better. Like
Yep,
it's
for
just
sure. Patty says, "What sunscreen do you guys like? I have rosacea, and also use Saint." So, honestly, tinted sunscreens work better for covering redness. They block the redness some, and then actually block the UVA UVB better. If you wear Saint, we don't like silicone products. Or products with silicone because they can make it kind of sticky and cakey. Although I will say Elta MD is one of my favorite sunscreens. It is zinc, it's sheer zinc. It does have silicone in it, but I've never had it react with my makeup. And so that is probably one of my favorite ones. I like the Elastin sunscreen. CeraVe AM is good. La Roche-Posay Double Matte sunscreen is good. There are a lot of good ones. Those actually have silicone. So that's going to kind of be one of those things where you have to try it. Miranda was just using the Pomifera BB cream with sunscreen. We both love it, and it does not have silicone in it. So honestly, if you struggle with some redness, I don't know if you do, Patty. I'm not sure. You just said what sunscreen do we like, but if you struggle with some redness, tinted is always good, and a BB cream or a CC cream that's a little bit moisturizing without silicone. If you wear Saint, if you don't wear Saint, you should be. No, I'm just kidding. But but the silicone doesn't really matter. So, but LTMD is one of my favorites. Elastin, I've been using the tinted sunscreen from Elastin, and I am actually really in love with it. It doesn't have silicone in it. It is a little bit more expensive, and I tend to go for simple, not expensive stuff, and I like to have that option for you guys. But I really do like that one. So those are kind of some options. We can link those. Pomifera, Elastin, LTMD. La Roche-Posay has some good ones. CeraVe AM. If you don't like a lot of steps, because we're minimalists over here, CeraVe AM has sunscreen in the moisturizer. So bam, one step. That's it.
You
So
this on sunscreen because I just asked you the other day. Reapplying during the day for your face. There was one thing you told me about, and I know that's like a thing for women, right? Because we typically put our sunscreen on and then makeup, and we're out at kids' sports or out in the backyard. So what
sure.
was it that you said during the day if we need to reapply? Because that's not, if I put this on in the morning, it's gone by 1 p.m. when I'm outside with my kids.
Yeah. Especially if you're at the beach or the pool or whatever. So if you're outside all day, every 2 to 3 hours, you got to reapply. Color Science has a powder sunscreen, and it is not like, it's got a little color, I think, but nothing like crazy. You can literally just brush it over your face when you're outside, and that's it. It is the best thing. Okay, so we could link that too. Let's see. So we have about 5 minutes. Can products with their vitamin C cause some redness? Yes. Some people can't tolerate vitamin C. Okay. And the percent matters. So I did a reel on this or a story on this, I can't remember, the other day. Vitamin C is normally like 10 to 20%. If you have sensitive skin or you think vitamin C irritates your skin, which can happen, you want to be on the lesser side. So you want to be on like more the 10% side. I use a 15% because sometimes I feel like a 20% is really harsh. So if you're one of those people that have like leathery kind of skin that can tolerate anything, or like, a lot of sun damage, then you may want to go with 20%. But for the average person, I say 15%. For the sensitive person, I say 10%. And then some people just can't tolerate it. Some people can't tolerate the vitamin C at all. And that's okay. There are other things that you can use. And we can, that's another topic. But yes, vitamin C can cause some redness. And if it does, I would say you probably need like a lesser strength.
And vitamin
Or
C in the morning.
a different product. Vitamin C is in the
And
morning.
I remember
Yes,
that
because
because like I have just started adding some things into my skincare routine. Like Hallie and I, when I tell y'all, literally a year, 18 months, we're like face wash, moisturizer, and sunscreen
moisturizer,
cream. That was
sunscreen.
it. And so we've just added in vitamin C in the last 8 weeks. And I mean, not. I do have on makeup, Saint makeup. It's very light finish right now, but I have to remind myself vitamin C is like from the sun, right? So I'm going to be in it during the daytime. That's how I remember it goes on in the morning.
So why? Because vitamin C with your sunscreen is literally a powerhouse antioxidant combo. Okay. And so vitamin C makes your sunscreen work better to decrease the free radicals. Vitamin C is an antioxidant. So we talk about eating antioxidants like blueberries and all that kind of stuff to destroy the free radicals that cause cancer. all the things. Okay, vitamin C is a topical one of those, and so it's literally destroying all the free radicals that you get from the sun, from pollution, all the stuff of our face every single day, and making your sunscreen work even better. So if you can tolerate vitamin C, I feel like it should be in your regimen. Yes. Okay, so what about a skincare consult? Yes, if you don't live where we live, and you can't like make an appointment, I will be happy to see you anytime. But if you can't, or if you don't want to pay to go to the dermatologist, sometimes that can be expensive, whatever. I have a skincare consult. It's on my website. I'll post the link to that. And so it's literally just you answer a bunch of questions. Some of them you even like upload a picture of your face, like what you don't like or struggle with, redness, melasma, whatever. And then I take a look at that and literally recommend products specifically for you, for your skin type or for your skin issues, or what you want to work on, and link them all there, send them all to you, so like you get a specific for your skincare consult. So if you want to do that, we can do that too. I love to help you guys, and I can link that as
Like
well.
y'all, when I tell you, this is like Hallie's wheelhouse, the whole skincare thing. I feel like makeup, I'm good about like the color science part of it, the redness, like picking your custom colors. With skincare, this is her job and she does it every day. So many things about the skin, but like she knows so many different brands for skincare and how to target these different skin needs with your skincare,
Yeah.
which is so cool to
And
me.
I'm not ragging on my skin, but I never took care of my skin. Okay. And if you don't or haven't, it's not too late. Okay. That's what also what I want to tell you guys. I never took care of my skin when I was younger. I literally went to bed with makeup on. I didn't wear a lot of makeup, but I did. I never wore sunscreen, all the things until I started dermatology. And so literally a few years ago is when I really started taking care of my skin. And I feel like it looks decent. I do a lot to it now, but I am one that I don't do a ton of steps. Okay, so I like simple and I like affordable skincare because I don't think it should be hard. I don't think anything should be hard. It should be harder than what it is. So I do have some makeup on now, but there's not a lot that I recommend to you guys that I haven't tried, and except for stuff like rosacea, I don't have rosacea,
But you
but
usually
I'll just try it on
like
Miranda.
Hallie's been
I'll
good
just try it
about
on
she'll
Miranda.
say, I'm gonna send you this. I want you to try it and let me know how it goes. But she also, you do know, like Hallie's great about being like, no, you don't need to try this right now. You don't need retinol.
Yeah.
Like you don't need whatever, you know.
And I'm pretty honest, so like I'm not gonna tell you need something if you don't. You know, a lot of people get nervous about like sales and that kind of thing. Like if you don't need it, I'm gonna tell you don't need it. And if it doesn't look good, I'm gonna tell you it doesn't look good. But anyway, I just, so I like simple, I like affordable. There are some stuff that I'll splurge on, and I like kind of procedures. Like I think if I'm gonna spend money, I would rather do it on procedures instead of skincare. So I get this kind of skin, and once again, not bragging, but like I work on my skin, but with the simplest way and the simplest products. So you can do that too. Like it doesn't have to be hard. That's what I want you guys to know, that your skincare and makeup routine doesn't have to be hard. When I get in the shower, I put my vitamin C on, then I put on dermatology prescribed compound cream, kind of let it sit, then moisturizer with BB cream. Perfect, Tiffany. That's awesome. Okay, so the order would go like that, right? So it would go like wash your face in the shower, put on your vitamin C, then whatever your dermatology compound cream, like rosacea cream, azelaic acid, cilantro, whatever. Yes, perfect. Sit, moisturizer, awesome. The order's perfect. Okay. No, Tiffany, your order's great. You shouldn't be doing another order. All right, one more thing, and then we got to hop off. I've actually got to go to work. If you have more questions, send them to us. Follow at Miranda Kate. Follow me if you don't already. Send us. We want to help you. We want to work through your skin. Let's see, one more. What do you think of the Korean skincare people are talking about? So Korean skincare is like the albeit of skincare, apparently. Okay, it's very good. It's like anything else, though. There are good and bad. And so, I'd have to look at it specifically and like the ingredients and that kind of thing. But Korean skincare, as far as like the rules and regulations, is monitored very much higher, I think, than American ones. And so I do think Korean skincare is good. And if you look at their skin, it looks good. It would just depend on which one, because be careful, because Americans have adopted this Korean skincare thing, kind of like promoting it as Korean, and it's not really Korean because Korean skincare is so like, I don't know, like people love Korean skincare. So just be careful. Do your research. Message me if you have a question. But yes, Korean skincare, true Korean skincare is supposedly really good. Like all the dermatologists rave about it. But I want you to know that there are brands like CeraVe and La Roche-Posay that are just as good. I mean, and other brands that we have here that are just as
And
good.
I will
Okay, we're good.
Allie's got to get off, but
Oh,
I think that was a huge thing right there that she will often tell you, like over the counter, or like she can tell you what to get wherever, and it's just as good as maybe something that,
it's expensive.
yeah.
Yes. I think there are a lot of good skincare brands. Like people ask me about Obagi and they ask me about La Mer and they ask me about, okay, yeah, those are good, but I'm not spending that kind of money on it. Okay. And if you want to and you have that kind of money, I think that's great. But I also think you can get that result with affordable skincare. All right. I'm hopping off. I'm going to see some clinic patients. We love y'all. We're happy to help y'all. Let us know what we can do, and maybe we'll hop on soon for something else. If y'all have other questions, let us know.
Thank
All right,
y'all.
bye, girl.